The following is a paid advertisement of St. Anthony Hospital Orthopedics. References to any specific product, services, or entity does not constitute an endorsement or recommendation by St. Anthony Hospital, Carroll Broadcasting, or its advertisers. The views expressed by the host or guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. Welcome to the St. Anthony Hospital Orthopedic Show with Dr. Richard Godding. Dr. Godding specializes in joint preservation, reconstruction, and replacement surgery, and brings over 25 years of orthopedic excellence to St. Anthony Hospital and to the Carroll area. For more information about Dr. Godding, his practice, or St. Anthony Orthopedics, go to santanthonyhospital.org or make an appointment by calling 712-794-5536.
Good Sunday morning, Iowa. It's Dr. Rick Godding. Thank you for choosing to spend some time with me here this morning. And so I've switched up. I'm always talking about not just your musculoskeletal health or things that are orthopedic in nature, but your overall health. And I've just had to switch up how I address my overall health because of my musculoskeletal health. And that is something that, as you get older, you gotta start having to adjust things. So I haven't lifted heavy weights in a very long time, like 3 years. I just basically got to the point where I'm like, what am I even doing? Why? What is the point? If you're, I do understand that there are people who are power lifters and that's what they want to do, and that's okay. I think for most people who are just at the gym to try to stay in some kind of shape, I think trying to lift heavy is something that is not only not necessary, but probably going to cause more injuries than the health benefits you're going to get from it. And when I say heavy weights, 3 years ago, I was lifting really heavy, like bench pressing a lot for me, but it was pretty heavy. And doing as many reps as I could and getting down to, where you do the 2 reps and going almost to your maximum. And I just thought, God, my shoulder hurts. Why am I doing this? So that's when I moved over to doing push-ups and some assisted pull-ups and curls and, I got a little bit, and the reason I'm sniffling is I think I'm going to get into why I think I'm sniffling. That was what I did, and it started to work out pretty well. I do hill sprints, as I have discussed. I think sprints or high-intensity interval training, which means that you essentially sprint in whatever capacity you are doing, like if you're on an exercise bike, or a Stairmaster or whatever, you're doing it, maybe 45 to a minute of very high intensity, and then you're going to rest a couple minutes. So that's why I sprint. And when I say sprint, I just mean I'm running as fast as I can. That's not very fast. You wouldn't look at me. It's like if you passed me in your car, you would say, "Oh, that guy's running." You would not think I was sprinting, but I'm sprinting. You just can't tell because I'm giving it all I can. So more recently, I found my hands starting to hurt a little bit. And so the things that I do for my hands, I play guitar and I play a lot. And then I operate, and either 1 or 2 days a week, I'm in the OR for several hours. And orthopedic surgery is very muscularly intense. We have to hold things very tightly sometimes. We have to lift things, and so it's pretty hard on the hands. And then I'm in the gym lifting. And so I said, all right, well, I'm not going to stop operating. And my hands, they're not terrible, but it's like I'm starting to kind of feel it a little bit. And I think, I need to once you get to be a certain age, you shouldn't wait until, I guess it doesn't matter what age you are, but especially once you get over 50, don't just keep doing something and saying, oh, it hurts, but, I'm going to keep doing it. And then eventually, then you've got a problem. And then when you do change, the damage has been done. So obviously my hands are my most critical asset for my well-being and my family's well-being, my patient's well-being. So I want to be careful with them, right? And so when they start to hurt a little bit, and again, it's not bad, but it's enough that I'm like, this is kind of new. I've not had my hands feel like this. And I did increase the amount of guitar playing I'm doing a fair amount. So I said, all right, well, I'm not going to be a surgeon. Typically, I've been playing acoustic guitar, and I had one electric guitar. Basically, I'm going to play, the long and the short of that story is I'm going to play a lot more electric guitar and a lot less acoustic guitar. just for the practicing and the learning aspects of it, because and I've been playing guitar my whole life. I mean, for as long as I can remember, so it's not a new thing. But the electric is much easier on the hands, so that's a change I made. I'm going to play a lot less acoustic guitar, and then I lightened up on my strings. And the reason I'm telling all you this is because I'm just kind of giving you a framework for, well, what could you do if you had an issue? How would you address it? And this is how I've been addressing my own particular issues. And so I was doing push-ups 2 to 3 times a week, a couple hundred, to 200 to 250 push-ups 2 to 3 times a week. So 500 to 750 push-ups a week. And push-ups are kind of tough on your hands. And so if you go to your knees, well, you're just not getting the chest workout, right? So I've cut those for now, and I've gotten in the pool to get that sort of upper body workout, some additional cardio as well. And I find it's been a while since I swam. I mean, I surfed for years and years, and I think we are actually going to take the family on a surf trip this winter because the family has surfed on some vacations and they enjoy it. Family meaning the daughters. Mom's never been a fan of being in the water. She likes to sit on the beach and watch. But so it all kind of comes together. But what I'm saying is I'm adjusting what I can adjust. Like the surgery is the surgery. I'm going to do the number of surgeries that come in and get scheduled, and I'm going to do what I need to do in them. And so you can't change that. But I can change from doing the push-ups and the curls, the biceps curls and the assisted pull-ups and those things that I do in the gym. I'm going to dramatically reduce them, if not cut them out completely, and substitute swimming. And it's one of those things where it's something that you do as you get older. And, and so I adjusted my guitar playing. So I have a problem with the hands, not very bad problem, just kind of at the end of the day, like, these are a little bit more sore than I would like. So I adjust it so that I don't keep doing what I'm doing. And then a year and a half, 2 years, 3 years from now, oh man, they're really hurting, and I'm gutting through it, and I'm taking, maybe I would have to start taking Motrin or something, an anti-inflammatory. I just don't want to go there. So I'm adjusting everything I'm doing. And so that's the sniffling, I think, is because I got this new headphone set for swimming, and it actually vibrates on your bones, so there's nothing in your ears. And the one day I forgot my earplugs, and so I think some water got deep into my ears and my nose and things like that. So that's the sniffly part. So the point is, how do you address as you're aging and you start to have some pain somewhere? What I would say is, if you're having pain in your hands and it's kind of both your hands and it's after a lot of effort, do what I've done and change those things that you can and kind of go from there. And then if that doesn't work, go see your doctor. With the shoulder, as I've always said, any shoulder pain, if you're over 50 and you've got shoulder pain that has been present for longer than 2 months, you should go see a doctor. And so if you go to see a primary care physician and you say, I've had 2 months of shoulder pain, my experience is what they're going to do is they're going to get an x-ray, which is always the right thing to do. Make sure you don't have anything else going on. Once you get over 50, any kind of pain that doesn't go away should be x-rayed. And then they're probably, in my experience, going to send you for some physical therapy and give you anti-inflammatory medications, which is the right answer. Some of them will give you a cortisone injection, which is not a wrong answer at all. And then if that persists, then they're going to send you to see an orthopedic surgeon. And, I sometimes will have patients come in and they've been seeing a chiropractor or somebody else, massage therapist, somebody who is helping them manage the symptoms. And the symptoms are more manageable, but they're still gradually getting worse and certainly not getting better. Again, go see your doctor, go see an orthopedic surgeon. It's fine to work with a chiropractor, work with a therapist, but if that pain continues to not go away, don't just keep doing something, whatever the thing is, to treat the symptoms. Don't just keep doing the thing that treats the symptoms. If the pain doesn't go away, make sure you find out where the pain is coming from. And the only way to really find that out is to get an x-ray and an examination by an orthopedic surgeon. And so in the knees, if you're over 50 and your knees are hurting, it's probably Arthur. It's probably Arthur. Arthritis sneaks in on all of us. And again, it's perfectly reasonable to do whatever you want. Go. Let me circle back here to the shoulder, because I want to talk about the difference in the urgency of shoulder pain versus the urgency of knee pain. And why I'm saying 2 months in the shoulder is because you need to get in to see somebody. You need to get yourself on the track to see somebody if your shoulder's been hurting longer than 2 months, because if the rotator cuff tears, sometimes we can fix it. Sometimes we can't fix it. And if we can't fix it, then there are bigger and bigger surgeries that we have to do, the biggest of which would be a reverse total shoulder, which you may have heard of, where they put the ball where the socket was and the socket where the ball was. And, that's a big operation. And if you can get in earlier, a lot of times you can fix the smaller tears in the rotator cuff. So there's just this big, very big difference. I say this to the farmers, but everybody can understand the logic. If you have a combine and the wheel on the combine is squeaking or, God forbid, wobbling, you are not going to drive that combine out in the field and wait for the wheel to fall off while you're in the mud, right? You're going to get it taken care of. Probably the first time you hear it squeak, or at least if it doesn't go away. Well, you should treat your shoulder the same way. There's not urgency, but there's a sense that in the shoulder it can deteriorate if that rotator cuff tears, and then the tear gets bigger and bigger and bigger and unfixable. Well, you have a bigger problem on your hand, dramatically bigger. So what I would say is shoulder pain, much more so than hip or knee pain, should really get looked at in a timely fashion. Now, hip or knee pain are different too, because hip pain can be a few things. Hip pain can be arthritis, and hip pain also could be back pain radiating to your hip. And, and then there are things like avascular necrosis, where the head of the hip is dying from sort of a lack of blood supply. So the hip is even a little bit more urgent than the knee, but less urgent than the shoulder as far as time-wise. But any pain, boy, if you got 6 months of pain and you haven't had it looked at, you really need to have it looked at, no matter where it is, because you can have cancer. If you're over 50, cancer is out there as something that you may end up, and primary bone cancer is pretty rare, but it happens. And a lot of times, actually, cancer in the bones it's either going to be a lymphoma or a myeloma or a metastasis, where the tumor has come from somewhere else and resting in your bones. So it's not that often, but again, once you get to like 6 months and things like that, man, get in and get seen. At 2 months, if it's shoulder pain, get seen. If it's hip pain or back pain, you could still work with your therapist and take your anti-inflammatories. Knee pain, again, once you have your x-ray with these, you're pretty much okay. But you do need to get in and get an x-ray at some point. And then if they don't see anything, sometimes they might want something different. Like if you have a perfectly pristine hip and you have a lot of hip pain, I'm going to get an MRI, see what else is going on. If you have, and the same would be in the knee. If you have a perfectly pristine knee pain and you have a lot of pain, or perfectly pristine knee x-ray and you have a lot of pain, and I can't tell from the exam, then I'll get an MRI. But the knee pain, if you're over 50, it's mostly going to be arthritis. You may have a meniscal tear, but if you have a meniscal tear, so the meniscus is the cushion in between the bones. If you have a meniscus tear and you're over 50, most people over 50 with a meniscus tear, it's part of their arthritis. It's not like a healthy knee with a torn cushion. That's just not how it usually works, although I have seen it. I remember one guy in particular that was in Australia, and he was 70 years old, and we did an ACL reconstruction on him, which is something you typically wouldn't ever do. But his knee was absolutely pristine, and he was still playing some, I don't know if it was field hockey or something. But these are very rare situations. Typically, if you're over 50 and your knee hurts, you're going to have some level of arthritis. That's going to be the primary problem. You may or may not need to treat the meniscus tear, depending on how bad the arthritis is. So the arthritis is the breakdown on the cartilage on the end of the bone, and the meniscus is the cushion between the bones. Although the cartilage itself is a cushion, but the meniscus is a separate piece of cushion in between the bone ends, which have cartilage layers on top of them as cushions. So if that's torn and you have very good looking cartilage, you might still get a knee arthroscopy, a scope surgery to take out that little tear. So with the hip, again, oftentimes people will confuse hip and back pain. And sometimes it's hard even for the doctor to tell the difference. But hip pain is typically in your groin. Hip pain is not if you're reaching over to your butt or even your side. That's probably not hip arthritis pain. That's probably either sciatica pain from your back, from the nerves as they get compressed coming out of the spine, or it might be what we call trochanteric bursitis. That's sort of right directly on the outside of your hip. And the bursa is a little sac that comes between the outside of your femur bone and the tensor fascia lata, which is this long band of basically tendon that is on the outside that helps you with walking. And the differentiation can be super important. And if you have groin pain, then that's most likely, if you're over 50 and you have pain in the groin, especially when you walk, that's likely to be hip arthritis, just because that's anatomically where the hip is. People think the hip, I think it's because maybe the old knee bone connected to the hip bone dance or whatever, but your hip is a joint, and it's inside, it's deep, it's in the groin. The pelvic bone has the pubic symphysis right out in front. And then right behind that on either side are the sockets, we call it the acetabulum. And those are, like I said, pretty deep. So I guess the overriding message is, if you're having pain for greater than 2 months in your shoulder, you should see a doctor. If you're having pain greater than 6 months anywhere in your body, and you're over 50 especially, you should see a doctor. If you're going to sort of self-manage the pain, which is fine at first, of course, do it through modifying the activities that you do on a daily basis. Specifically, the heavier the activity, figure out how to cut the weight down. You can still do the activity, and I understand for some people it's work, and it's very hard to do. But if you're used to lifting, let's say, 80-pound bags of seed, well, maybe get the younger guys to lift the 80-pound bags of seed. But just do what you can to modify your recreational activities and your professional activities. And, working through the pain is okay most of the time when you're 20. When you get to be over 50, over 60, especially over 70, working through the pain it can be doing damage. I remember my old football coach, you got to separate pain from injury. Rub some dirt on it. Yeah, that's some old thinking. And I'm not sure that's the best way to do it anymore. If you have pain, try to adjust what you're doing. If it lasts longer than 2 months in the shoulder or 6 months in the knee or hip or back or hands, then go get it checked out. So that's just some basic, I guess, common sense advice, but just wanted to share that as I, share my aging journey with those of you who are aging together with me. I'll be turning 56 in May, so I'm totally headed towards, I think I qualify for all the senior discounts now, and I'd rather just not pay it. I'd rather have them not ask me than get the senior discount, if you know what I'm saying. See if I'm passing for 40s. But with that, enjoy the weather, try to get active, do it in a measured, slow, safe way until you got your feet under you, and if you are in some pain and you're not getting better, then you should see somebody about it. So you have a blessed weekend.
This has been the St. Anthony Hospital Orthopedic Show with Dr. Richard Godding. For more information about Dr. Godding, his practice, or St. Anthony Hospital Orthopedics, go to www.santanthonyhospital.org or make an appointment by calling 712-794-5536.